Caden was our first pregnancy. And so we were obviously really excited to be pregnant and did end up doing the NIPS testing at our 10-week blood draw. And mostly just to find out the gender and to rule out, obviously, what I thought was all genetic conditions. And so that came back normal. And we found out that we were having a little boy. And so added to the excitement, obviously, once we knew the gender. And then, at our 20-week anatomy scan, we came back with bilateral hydronephrosis. And so a concern for the baby, but obviously in the grand scheme of things felt relatively small and is more common in boys. And we were told that it can, resolve itself throughout the pregnancy and just would maybe require some additional monitoring. And so I came back at 24 weeks for another scan, and it had gotten worse. So his kidneys were dilated and were continuing to get worse, specifically the left kidney. And so at that point, we were transferred to a high-risk MFM clinic just to be monitored more closely for that, as it was obviously not resolving and was in fact getting a little bit worse. And then at 27 weeks, at another scan, the kidneys were continuing to dilate, and I was also diagnosed with polyhydramnios, so the high amniotic fluid levels. And I think that answered some of the questions of I was feeling pretty uncomfortable. My stomach was very firm. I felt very big for that early in the pregnancy. And then, a few days later, I actually went into preterm labor on our baby moon in San Diego. So really, really bad timing to be flying and on a baby moon. But we were admitted to hospital in San Diego for 5 days for preterm labor. And thankfully, he was able to stay in. We were able to receive all the steroids and magnesium drip to help in case he does come early or did come early. But we were able to get back to Washington, where we're from, and continue the pregnancy just with more monitoring. And so we had a lot of frequent flying miles to labor and delivery at University of Washington to the MFM clinic as we were monitoring, because I continued to have contractions. And then at 32 weeks, my water broke, and we were admitted to University of Washington, still trying to keep Caden in as long as possible. But I continued to progress with labor. And so at 33 weeks, because he was breached when my water broke, we delivered him via C-section at University of Washington.
27 weeks as things started to progress. And obviously the first scare with possible preterm labor was more of a realization of there could be effects and there could be long-term ramifications of this type of pregnancy. So that was the first time I think that we started to realize maybe there's something past the initial pregnancy that could be an issue. But I don't think it was until a full diagnosis after he was born that it really dawned on at least me that there was going to be things that we were going to be dealing with the rest of our life.
Yeah, I'd say in hindsight, not having the genetic referral, now knowing what I know, I am shocked that it wasn't a conversation. We saw 2 different MFMs, one at Scripps in San Diego and one at UW, and genetics as an issue or problem or potential outcome was never discussed. And so, I specifically remember the MFM in San Diego saying, a lot of these polyhydramnios preterm labor cases are idiopathic, meaning we don't know why they happen. And now, again, I know I'm biased, but I feel like so many of those patients and cases are probably genetic conditions that are just undiagnosed, right? And so when we were talking about doing this interview, the one thing that I wish would have been brought up is that potential risk for genetics, because I would have felt maybe more prepared. I know it comes with added anxiety and worry that maybe is unnecessary if we never got a diagnosis, but I felt like we were blindsided once we got the diagnosis the way we did, because we were never even told that was a potential possibility. And again, I thought us doing the NIPS testing and that being negative covered everything, right? Again, the naivety of not knowing what I know now of I thought we were in the clear for genetics.